Hello, everyone. This is Lynn from Holistic Health and Wellness, and welcome to another Living Life Naturally podcast. So, today, our special guest is Dr. Kike. It's Kike Oduba, but I'm going to call her Dr. Kike. It's a lot
Okay.
easier. So, she is a functional medicine physician, a health coach, and a public health specialist. So, Dr. Kike specializes in medication free chronic disease management through her breakthrough nutrition and lifestyle protocol, NutriShift. She developed a strategy for reversing chronic diseases through a personal experience with an autoimmune disease condition, Hashimoto's thyroiditis, and extensive training at the Institute for Functional Medicine. So, with an understanding of how important personal touch, listening ear, and continuous support is to an individual with chronic illnesses, she cares for her patients not just from her head, but from her heart. So, a big, huge welcome to you, Dr. Kike. We're so glad to have you here.
Thank you for having me. Such a huge pleasure.
So, we've had a few technical difficulties today. So, if you see me with my microphone up here, that's why. So, there's always something. This was a lot of fun trying to get together today. So, Dr. Kike, tell us more about what you do.
So, what I do is functional medicine, and functional medicine is a model or a way of looking at a disease state, not from the perspective of a diagnosis, but from the person. We try to look into the root causes of disease and symptoms so we can treat the illness from the cellular level and help the person recover. We also try to incorporate the different aspects of a person's life, ranging from emotions to spirituality to family life. And pretty much, we're treating the total person, not just a diagnosis. Functional medicine also helps physicians who practice in that model partner with the patient on a much deeper level. It helps you to understand the person and their own perspective of their illness, rather than the way you see it or know it in your head as a physician. I like to say this to my patients, and this is my philosophy, that good medicine is not a doctor dictatorship, it is a patient partnership. So it's pretty much flipping that narrative about the doctor being the main driver of how a person's health is taken care of. Rather, we put the patient in the driver's seat and then we partner with them to achieve their own wellness.
Yes, so what I love about functional medicine is it does get to the root cause. So, from my
Right.
perspective,
Hmm.
you go to the doctor and they hand out a pill to you. Um,
Right.
and so, as a way of explanation to people so they can understand it, is for years I've had a high potassium level for
Hmm.
like 7 years. And the doctor has just had me on this absolutely disgusting powder medicine to keep my potassium down.
Hmm.
So I finally said to him, this is absolutely ridiculous. We have got to get to the cause and the root cause
Right.
of why my potassium is high. So
Hmm.
now, really, because of my own advocacy, I've gone to a nephrologist. And so now
Hmm.
they're doing the calculations so that they can help me. And maybe
Right.
there's some other way, because when we're sick, there's always a root cause for it.
That's right.
Correct.
That's right.
And so, why is this specific cause or initiative important to you specifically?
Um, that's a great question, and I'll start with my personal story from my experience with an autoimmune disease diagnosis, Hashimoto's thyroiditis. So I started having a ton of weird symptoms, like a few months after I had my second child. That was over 6 years ago, and I kept looking for answers, wondering why am I having these symptoms. No physician could really tell me what was going on. So I had highs, I had I wasn't sleeping. I couldn't fall asleep. And even if I fell asleep, I'd sleep for maybe 2 to 3 hours. And so it was just so it was difficult finding out what was wrong. So over the course of many months, I found out that I had a swelling in front of my neck. So I knew it was my thyroid. Okay, so I went to the doctors and they said, okay, we have to take out this thyroid. It's toxic and it's causing you to get really sick. However, one thing I remembered was my symptoms started about 2 months after I got an IUD, which is an intrauterine device, which was the Mirena one. And so somehow I kind of related my sickness to that. So I said, you know what, first take out this IUD. Maybe it's a trigger. I don't know why I think it's related, but just take it out. So they took out the IUD, and within 2 days, my headache stopped. And within a week, I was sleeping better. So in my head, I was like, oh, maybe the IUD, caused this, sickness. But then how do you explain the relationship to my thyroid? So I started doing the research. All the physicians told me, no, it has nothing to do with the Mirena. You have to take out your thyroid. Now, one thing is, I know what it is like to have your thyroid taken out. What it means is for the rest of your life, you're going to have to live on synthetic thyroid hormone, which was for me a big no-no. I don't want to live with medications for the rest of my life. At that time, I was 29 years old, so I felt like, no, that's not what I'm going to do. So I started looking for alternatives. Now, as I was looking for alternatives, I found naturopaths online who wrote about reversing thyroid disease. And so I read and then started buying some of the supplements they recommended. At that time, I really didn't understand it because to me, my conventional way of thinking doesn't, marry with the idea of healing a thyroid with supplements. It just seemed off. Not only that, I started learning something about molecular mimicry. I had heard about it in medical school, but we weren't taught about it clinically to understand how it relates to patients with hypersensitivity to foods or chemicals in the environment. And so I began to eliminate foods like dairy, gluten, nightshades because they somehow feed into autoimmunity. Believe it or not, within 2 months, of just eliminating those foods and also being on some mild supplements like ashwagandha, the rhodiola. My numbers, my autoimmune numbers, thyroid antibodies against my thyroid came down from like over 1,200 to 600 in 2 months.
Wow.
That really shocked me. I thought, how did that even happen? I wasn't on any medication. I wasn't on any, I didn't get my thyroid taken out, but my antibodies were going down. So that kind of caught my attention. However, one thing that didn't happen was my highs and sensitivity to foods did not stop. So I kept seeking answers because it was so uncomfortable. I had such a bad relationship with food. So I went to see a gastroenterologist. They ran some conventional tests and they found nothing. They were like, oh, nothing is wrong with you. It has nothing to do with gluten or dairy. We'll just refer you to an allergist. So the allergist took a good look at me and said, how about your vitamin D levels? Let's check your vitamin D levels. Now, when he checked my vitamin D levels, my levels were super low, like 21, and the normal should be between 50 and 100. Optimal is around 80. And so he put me on high dose vitamin D. However, he told me that my condition was an idiopathic urticaria with angioedema. Now, when they tell you something is idiopathic, it means it's peculiar to you and there's no cure. It's just going to keep happening to you. There's no reason why it's happening. It's just because it's you. And so I'm trying to make it sound simple as much as possible, not talk too much medical jargon. Well, you understand what I'm trying to say. And so when he said that, he put me on a cocktail of 4 different pills. Now, one was supposed to make me kind of hallucinate, another was supposed to make me feel very tired whenever I woke up. And over the course of a few months, it's like my mast cells will be stabilized and I would stop having those highs. I tried that for a week and it seemed like I was gonna die because I went through horrible, horrible fatigue. And so I was like, nope, I'm not doing that. Fast forward, I began doing more research. Like, why do I have these highs? Why am I so sensitive to food? And so I found the Institute of Functional Medicine, where they wrote something about leaky gut and a leaky brain, autoimmunity, and how it relates to gluten and dairy and certain infections. I put everything together and realized, oh, okay, something is going on in my gut that needs to be further investigated. To cut the long story short, I started attending their conferences. I learned a lot about their protocols, and that's how I got myself, healed. And, I started putting some things. So it was like functional medicine kind of put a structure around what I had been learning and trying on my own to get myself to heal. I don't know if that makes sense.
Mhm.
And so that kind of helped me create my own pathway to healing. And it kind of shaped my whole idea of how wellness should be. Now, one thing that really cut through for me was the fact that none of the doctors that I went to listened to me. You know, they didn't believe in my own perspective of my illness. I was convinced that food was related to my thyroid issues. They were convinced it's nothing related. They believed it's idiopathic. It's just your body doing that. I actually asked the gastroenterologist, I said, do you know about leaky gut? What do you think? He's like, leaky gut is hogwash. No, literally, this is a top-rated gastroenterologist. So at that point, I was like, oh, maybe I'm crazy. I should know better, right? We were taught better in medical school. But my body was telling me something different. My experience couldn't match, what I was being told in the textbooks, what I was being told by the conventional physicians. I mean, I don't blame them. They just don't know, better than what they're telling me. And so, like I said, finding functional medicine made everything come together for me. It helped me connect the dots, and things made better sense with functional medicine. And that's why I'm so passionate about it. At the point at where I was the lowest, it was like functional medicine was the only hope I had, to get better without having to depend on drugs or taking out my thyroid surgically.
Yeah, so many people when they're in their midlife have problems with their thyroid, and of
Right.
course we're not saying to them don't do what your doctor prescribes, but if you can find a functional medicine doctor or even someone like you online because you can see them virtually,
Right.
um, there are some alternatives because it is
Hmm.
very drastic to take out your thyroid.
Oh yeah.
Yeah.
Oh yeah. You take it out, there's no putting it back in. It's gone.
Right. So give
Yeah.
us some more specifics how you recover from Hashimoto's when you don't have surgical intervention or medications.
That's a great question. One thing I found out in my journey is the fact it's that the most simple things, the most simple things were the most important things for my recovery. Okay, so I drilled down my problems into five different things, root causes, my root causes, which I found out was common to most people with autoimmunity or any chronic disease to even, mention. Five things. The first thing being stress. I had a lot of stress in my life. Okay. Second thing was hormonal imbalances. From having babies, I barely recovered from the hormonal imbalances that came with being pregnant. Not only that, I had some, a little bit of complications during delivery, and so that added, more stress and also, made my hormonal imbalance worse. Coupled with the fact that I had the IUD, which pretty much threw everything off, in my endocrine system, in my opinion. From my research, I found out that hormonal contraception can do a lot of good to you to prevent babies, at the same time, a lot of damage to your general health. Okay. And so hormonal imbalance was my second root cause. The third being immune dysregulation. My immunity was poor. Okay, the only reason why you have autoimmunity is pretty much your immune system attacking self, attacking your body. it's recognizing your body as an invader. And so I realized, okay, my immune system is needing a lot of attention. The fourth thing that I found out was food. My diet was really, really bad. I just ate very poorly. I was eating a lot of junk foods because I was under stress. So I did a lot of stress eating, you know. So I realized that, okay, my food, my diet was a big factor feeding this chronic illness. And the last thing was toxins, okay? So toxins are very, very, sometimes you don't realize what you're toxic to. You just know that you don't feel well. And so we go through this cycle of detoxing and retoxing. So I figured, okay, there are some toxins in my food, in my water, in my beauty and cleaning supplies. I need to take those out. So when I figured those 5 things out and started dealing with them one by one, I began to recover easily with no medication, starting from sleep. I began to take more time to better my sleep hygiene. I decided, okay, I'm not going to be awake past this particular hour of the day. I was going to make sure I got at least 8 hours of sleep. I'd turn off all devices before bed. I was very strict about the way I slept. And I saw a huge difference in my health. One thing that many people don't know is there is no way you can restore the thyroid without adrenals being taken care of. So the way it works is your adrenal gland pretty much regulates how your immune system works, also regulates how your thyroid hormones are being produced. And so many people, they leave off that aspect of their recovery, that aspect of their health, and focus on just the thyroid, not knowing that there are many other things that are affecting the thyroid. Also think about the gut. The gut has so much to it. We all know that over 2/3 of our immune system lies in our gut by the way of our microbiome, which is the bacteria that lives in our gut, right? Putting all those things together, you would realize that taking care of your thyroid is beyond just taking it out with surgery or taking thyroid or any other thing at all to target the thyroid itself. It's a multifactorial thing. It's a multi-systemic effort, to heal the thyroid. Because whatever you're doing to treat the thyroid on one hand, and there's something else on doing that effort, you're pretty much going to go back to ground zero where you're trying to, heal and work yourself back up. I don't know if what I'm trying to say makes sense. So the whole point is recovering from the thyroid. It's not one thing, it's many things. It's many things.
Which it is in so many aspects of our health and wellness,
Right,
if you
right,
think
right.
about that. So you mentioned adrenals. So in my research, because I've had problems with adrenals,
Hmm.
but it's not like you can go to a doctor and ask them to check your adrenal function, right? So
Right.
how do you kind of know if there's something off with your adrenals?
Okay, so your cortisol tests, you need to get some testing done to test your cortisol levels. So for your adrenals, most conventional doctors don't look into the adrenals unless you have a specific illness, possibly Addison's disease or Cushing's syndrome. They wouldn't really look into it unless there is a specific need. Now, if you go to a functional medicine physician, they do different tests. There are many companies that offer this testing. The favorite one that I use is Dutch test. With a cortisol awakening response. It measures your cortisol levels, and it also, gives you a background of all your hormones, your sex hormones, and how they are all the interplay between all these hormones. So when you're able to see a big picture, you can, pretty much find out where you need to focus on, with your thyroid. And also, really, if you're not sleeping well and you're under stress, most likely you're going through adrenal burnout and your cortisol levels will be off.
So is that the case as well, say when you hit midlife and your sleep is so poor in comparison to what it used to be, is
Mhm.
it then something very often to do with cortisol levels?
Oh yeah, oh yeah. Your cortisol levels pretty much affect how you sleep, right? And of course, you know about melatonin, which is the sleep
Yes.
hormone. there is there's a relationship between your sleep hormone and cortisol, between melatonin and cortisol. So most times if you're waking up, say you wake up very early in the morning and you're still feeling tired, obviously there's a cortisol problem there. So when you measure cortisol levels, there's a 4 point measurement you have to do. I'm trying not to get too technical, but the point is you don't measure just one. You have to measure at certain times of the day, when you wake up, a few minutes after waking up, and then I think 2 hours after. So there's a way you do tests for cortisol levels, and it's a whole day thing, where you get to know what your numbers are at different times of the day. If you notice, some people, they have this midday fatigue and drowsiness. It's because of a cortisol issue, and so when you're beginning to see those, you're probably having some form of adrenal stress or burnout, really.
Mm. Mm. So you talked again about nutrition.
Mm-hmm.
So tell us about your upcoming project. Now I've got some
Okay.
feedback.
Can you hear me?
Yes.
Okay. So my upcoming project is NutriShift. NutriShift is pretty much those 5 things that I identified, as my root causes. It's pretty much flipping those and treating that. So NutriShift is nutrition, and shift stands for S, which is stress management, H, hormonal balance, I, which is immune regulation, F, which is food as medicine or food therapy, and T, toxin removal. So whenever I treat people, anybody with any chronic illness, I address those 5 things. And most times, if you're able to get those 5 things checked, you should begin to recover. You should begin to recover. And like I said, I like to call myself the medication-free health expert. Before I prescribe a medication to any of my patients or even give them supplements, I try and manage those 5 aspects with lifestyle and diet. If I can get those 5 things down, half of the work is done. Most of the work actually is done, because if your hormones are balanced, you're sleeping well, you have less stress, you're eating well, you don't have food sensitivities, and your immune system is working fine, and you're not exposed to toxins, really, how sick can you get that those 5 things cannot help you? You must have gone way into a very, very severe disease state before those 5 things would not be able to help you recover. So what I tell people is, don't look for the big things. Don't try and get a big diagnosis of what's going on. Of course, find out what's going on, get your root causes analyzed, but take care of those 5 things: your stress, your hormones, your immune system, your food intake, and the kind of food you're eating, and also eliminate toxins. I believe those are 5 pivotal things
Mm.
that affect low-grade inflammation in the body that causes chronic diseases. So pretty much that's how I operate, with my protocol.
Mm. So tell me, when you do this program, because I think that you've got one coming up that we're going to allow listeners to get into with you, and I will put the stuff in the show notes for that.
Right,
Um, but when people work with you on things like this, it doesn't have to be physically in your location, right? You'll see
right.
people via the internet.
Oh yeah, oh
Yeah.
yeah.
And so when you meet with your clients virtually, how do
Mm.
they get in touch with you so that they can make an appointment?
So if you, my website is drkike.com. That's drkike.com. On there, I have my services listed. You can book an initial appointment with me, and you can also get a functional health analysis where I drill down on all your root causes. I want to know, when was the last time you felt better? When was the last time you felt good or felt normal, right? I want to know, from the day you were born up until now, what has happened. So pretty much I dig down into your life for the past, how many years you've been living, and then I begin to tease things out. It's like an onion, you're peeling each layer. I usually do take my time with patients. I really don't like to rush things, because I feel like whatever is going on in your life, I cannot learn in a 15-minute appointment like, you would normally
Right.
get from a doctor. So for people who want to work with me, they should expect to spend at least their first appointment 90 minutes with me teasing all these things out. Another thing that I do is a lot of health coaching, okay? It's really hard for most people to change their lifestyle, to change how they eat. It's even hard for people to learn how to sleep better. It takes time to really begin to understand that, okay, my body needs more rest. Let me stay in bed. It's hard for people to let go of that overdrive. So I coach people through the process. I try and help them also learn what things they are toxic to that they may not understand, they may not be able to identify on their own. So I use a lot of tools, I do a lot of worksheets, and I'm coming up with a group now, a Facebook group also called NutriShift, where I can mentor people and help people. So as many people are in my program NutriShift, they get access to me via Facebook. I also have a WhatsApp group. So I'm originally from Nigeria, and so I have a group already in Nigeria that I work with, and so they're able to communicate with me. I usually have office hours as well where people can reach out, and we can have a chat and then encourage each other. So pretty much that's how I work with clients for now.
So I'm going to put all of your links in because I know that you're launching as a special offer for people listening to the podcast your 4-day detox.
Right,
And
right.
so it's free of charge, and all you're
Mm-hmm.
asking is for an honest review. So
Yes.
there's a
Yes.
coupon code that I'll put in there.
Yes.
So during that 4-day detox, what kind of things can people expect? That just a brief overview for our listeners.
Right. So my goal is one thing, to teach you how to detox without having to need it every time. So it's my goal is to help people break the detox routine. I feel like you really don't need a cleanse, like a drastic change in your diet or a cleanse to detox. I feel like you can start eating to jumpstart your liver to do the detoxing for you. The truth is, you will always have exposure to toxins. So, how can you eat clean? How can you eat well to help your body detox? So I call it the best way to detox without a cleanse guaranteed. That's basically what you should expect.
Good. And so, do you have any final thoughts for our listeners today?
Mm, I'll say this to people, what I say to myself all the time. I say to myself, Kike, you're one in a lifetime. Take care of you. Whenever I remember that, I realize that yes, have only one life to live, and I have to take care of me no matter what's going on out there. I have a family, I have a business, I have people, patients waiting on me. I come first because I am one in a lifetime. And I hope that encourages everybody, to take care of themselves.
So, I am going to let people know how to find you because,
Okay.
in many areas, we don't have functional medicine doctors. We talked about that before we even got onto the podcast. Certainly, in
Mhm.
my area, we don't have one. So, it's just a great opportunity to have somebody like you that they can work with remotely and get the help that they need. Because when
Right.
people are dealing with, especially autoimmune diseases, that can
Mhm.
be so hard. And I think our doctors tend to just want to give you a pill to treat the symptoms and
Right.
again not go back to what is it that was the root cause of this that we can deal with.
Right. Right. Yeah.
Right, so I really appreciate you coming on with me today,
Thank you
despite
for
our technical
having
difficulties.
me.
Uh,
Oh my goodness. Yes. Thank you so
so
much.
thank you for all your insight and your expertise. It's
Thank
been an
you.
absolute pleasure speaking with you.
The pleasure is all mine, Lynn. Thank you.
And to everybody, thank you for joining us today. We appreciate you hanging in there with us, and we'll see you next time.
All right. Bye bye.